Hi friends, welcome back. Welcome back to Alpha Physio Pelvic Care, all things pelvic health. If you're watching my videos for the first time, my name is Anastasia Varova and I'm pelvic floor physiotherapist practicing here in still sunny in the winter, Cyprus, and today is 17th of December already, and also online. Here on my channel that is dedicated specifically to pelvic floor and pelvic health, I share all my best tips, tricks, knowledge, information that I also get inspired from my clinical cases, from my patients, from their questions, and also from my social media. So today I would like to share a very important topic that came up lately after a specific case, specific client. I would like to talk about overactive bladder syndrome, stress incontinence and urge incontinence, and why these are getting quite confused, why it is important not to confuse them, what is the difference, and how in general terms they are approached, because the word incontinence is in both terms, and quite often urge incontinence is getting used instead of overactive bladder syndrome, which is not exactly 100% correct terminology. So let's have a look what is what and who is who. Before we continue, I would really appreciate your like on this post, subscribe to my channel for more information, and let me know in the comments, have you ever experienced any of these symptoms? Do you have questions about these symptoms? Have you ever had urge incontinence, stress incontinence, mixed incontinence, and how you treated them? So feel free to share your experience and I will be happy also to reply to you. In order not to make this video for too long and make it user friendly, so for somebody who hears first time about incontinence and all these terms, I'll try to simplify it for you, and I'll try to give you overview where later on you can also dive deeper in your specific cases if you do suffer from any of these conditions. So let's have a look first. What is stress incontinence, urinary urge incontinence, and overactive bladder? Now, stress incontinence, it is actually what it says, it's stress. When the stress is applied to your pelvic floor, got my pelvic floor here. When the stress is applied to the pelvic floor, it can be cough, sneeze, run, jump, any sudden movement that increases pressure through your belly into your pelvic floor. The pelvic floor and the sphincters around that are kind of attached and interconnected with the pelvic floor are not strong enough. You leak. You either leak urine or you leak also sometimes feces, but for the clarity, because urge incontinence applies more to the urine leak, we will stick to the urine leak. So when there is a stress applied on the muscle, or the muscle is really weak, you leak. And usually these leaks do occur with the stress, physical stress, intra-abdominal pressure increase, and they usually do not occur that much on the rest. Okay, so the person will sneeze, they will run, they might leak. So this is your stress incontinence. The main reason might be muscle weakness. It can be sometimes muscle tightness, so the muscles are just way too tight and they cannot contract correctly to support and provide the contraction, to provide the support for the pelvic organs. Yeah, so they're so tight they can't really move and function properly. This can also be the case sometimes due to the prolapse, but mainly it's also weakness and occasionally and sometimes miscoordination. So the muscles are too slow to contract. It can be due to some neural conditions, or it's just a habit and the body doesn't really know how to contract properly. This can be learned, this can be trained through specific exercises, breathing techniques, and so on. So stress, leak. Urge incontinence. Urge incontinence is mainly a dysfunction of a bladder. A bladder as a muscle, because our bladder, the fancy name for it is the detrusor muscle. It's a muscle that is under control of autonomous nervous system. So we cannot think, oh, let me contract my bladder and let me relax my bladder. We can't do that. So our nervous system does it by itself. So what is urge incontinence? This is when you have a sudden strong urge to go to the toilet, and sometimes you cannot make it. You don't make it to the toilet, you leak, you might leak a bit, and you might completely, the whole bladder will just evacuate, all right? The whole bladder will just empty, and you don't have any control of it. And this can come sometimes with a certain position, sometimes at a certain time of your life. If you are getting into perimenopause, for example, you never had such an issue, and suddenly you start to feel the urge, or you feel the urge to go to the toilet at night, or maybe you drink something that irritates your bladder and you have this urge. So urge incontinence can be part of overactive bladder, but when we talk about overactive bladder, it's the actual bladder issue. It's the bladder that is having strong contractions. Quite often person cannot control them, okay? They will not understand until it contracts and they completely either pee themselves or leak to a certain extent. It can be the part of urge urinary incontinence, but urge urinary incontinence, which usually would be irritation of the bladder, might come from somewhere else and not actually from the bladder. I give you an example so you understand. For example, if you had a cesarean section and the cut sits fairly close to your bladder, okay, you get scar tissues and they start to pull on the bladder, and after you healed, you feel like, I wasn't like this, and after birth, after my C-section, I want to go toilet every 5 minutes. I've just been to the toilet, I'm feeling this urge, or when I feel the urge, I have to go right here, right now. I don't even have like a warning, I need to run. So this is not necessarily the actual bladder the problem, or the nerve supply that goes into the bladder, but something very close to it, such as scar tissues that keeps irritating it. Or if you've been doing a lot of exercises, maybe you're a very sporty person, maybe you're a tense person, and you have very tight pelvic floor that keeps irritating your bladder, okay? This is not the pure overactive bladder issue. This is not the issue of the actual detrusor muscle. This is something else very close and around it that is bothering it and creates this urge incontinence. The reason why it's important to separate these ones and to figure out what is the primary cause is also medical and surgical treatment. This is very important. If you are going to get medication that relaxes actual bladder and detrusor, okay, you have to have a proper diagnosis of overactive bladder. Otherwise, you will have relaxed bladder and also stress incontinence. That might give you either no results or even worse combination. Or if you have, for example, tight pelvic floor, right, and it irritates your bladder, you'll get the medication, it will make your bladder relax somehow better, but the pelvic floor, that is tight, didn't go anywhere, it still keeps irritating, and again, you're not getting any results. Or is the bladder issue, but the doctor proposes, let's put you tape, let's do you stitching of the front vaginal wall because there is a bit of prolapse. That could be an issue. And it may be to some extent, but it might not be the primary extent. Maybe there is some kind of issue with the nervous system going on. So it's very important to figure out what is the main culprit. And I know this is not very easy, but at least there should be consensus if it is stress incontinence, if it is overactive bladder, if it is overactive bladder and urge incontinence as well, because the bladder can be overactive and you can feel that urge, but you might not be incontinent. You will feel urge and you will always make it to the toilet. That technically does not make you incontinent. Or is it a mixed picture? Do you get these sudden urges? Do you run to the toilet and don't make it? But also when you cough and sneeze as well, you lose your urine. So all these ones will have its own strategy. So what is causing overactive bladder? What is causing bladder to be overactive? Now we're talking about detrusor muscles. It can be some kind of non-optimal nerve firing that comes either locally from your pelvis around this area or from central nervous system. And there can be various reasons, different neural conditions, injuries as well. It can be bladder contraction and reaction to certain foods, certain colorings, irritants, alcohol. There can be many. So you need to find yours. It can be after a very stressful event. Okay, so the stress affected so much the nerve firing. Now they're firing constantly all the time and they're hitting your bladder. Some people will have other stress responses, and for you it's bladder. Okay, urge will be present usually in both overactive bladder and also in urge incontinence. In my practice, I have not seen somebody with overactive bladder without urge incontinence. All my clients, as far as I remember, with overactive bladder, they also had urge incontinence, so they did leak. And quite often it will be completely involuntary leak. It can happen with anyone at any age, younger people, women in menopause, men after operation. So it's a really different population. So this is why it is important to find which one is which, so you can develop a proper strategy. So I've been talking quite a bit, so let's summarize. If you have stress incontinence, usually it is either dysfunctional muscles, very weak, very tight, and they cannot support intra-abdominal pressure that is increasing, pressing on all your organs, and then you pee on a particular physical stress. Sneeze, cough, jump, dance, and so on. And when you are in a calmer state, usually the incontinence is not present. However, there are some more extreme cases. They would usually, again, involve neural dysfunction. But we're talking about commonly general population. It's issue of the muscle. When we talk about urge incontinence that can be part of overactive bladder, we're talking about sudden urge, urge straight after the toilet, inability to make a toilet, your urge is so strong, inability to hold, nighttime awakening. Usually these kind of urges are totally random. They can be caused by stress, they can be caused by anxiety, they can be caused even by certain movements, certain environments. People who are in an environment where they know they don't have access to the toilet immediately might, on the contrary, have even more stress and urge than if they would have, if they know, okay, toilet is nearby, and they're kind of more relaxed about that. So very random pattern. And you can have both mix, where you can have those random pattern of losing urine, of a sudden bladder contraction, and you also can have on the cough and sneeze when there is actual stress. I also made a video how you can address urge incontinence with TENS machine through tibial and sacral stimulation. Make sure you have a look at it, and that video will come after this video because it's important you know the basics first. So make sure you subscribe to my channel so you don't miss that video. Thank you for watching. I hope the picture got a little bit clearer. If not, feel free to ask the questions, and we will see you soon. Bye.